Jessica, testing's not widely available yet for COVID-19. Does that matter?
Yes and no, depends on who you are. So it's a data point. So we actually can count, if you will, know how many people actually have COVID. On the other hand, the healthcare provider is not going to change the way they treat you. They are still going to treat you regardless of whether the test is present or not. So I know that even nationally, they're working very diligently to get the test distributed so we can get a better handle of the prevalence of COVID and where we are now. But at the same time, don't let a lack of a test make you not isolate. It's important to take care of yourself if you're not feeling well and to stay away from others so you don't infect them, and follow your healthcare provider's advice around that. So testing is important, but it doesn't change the course of how you get cared for.
So, David, when we're spending time at home, it's tempting to turn on the TV and you'll flip across the news channels, and it seems like we're hearing a lot of the same news over and over. How much is too much news? What do we need to do to digest all this information in a healthy way?
So I think getting an update one time, no more than two a day, maybe in the morning, maybe in the evening, but not in the evening right before you go to bed. Okay. Find a trusted source, a source that you found dependable in the past for really good information. And then our temptation at a time like this is to binge watch all of the news programs over and over. And if you switch the channels, they just kind of have them repeating.
Mm-hmm.
And so that's our temptation. I don't know that it does any good. Get an update in the morning, get an update in the evening, go on with your day, focus on the things you can control at that point,
Great.
but limit those updates.
That makes perfect sense.
And Noah, to that end, and very well said, we have to think about how are we taking care of ourselves from the perspective of mentally, for watching these things. It has such a negative cataclysmic slant. And it's so important to remain positive in the face of adversity and look for those things that are positive, but more so think about sleep. If you are watching these programs right before you go to sleep and guilty, it's hard to fall asleep because your mind is trying to continue to solve problems.
Mm-hmm.
And that's been my experience. And it robs you of your sleep. Well, your body needs sleep to boost your immune system and keep it strong. So it's so important that body-mind connection is not, you just can't deny it. And you have to take care of both to remain really physically ready to stand in the face of this pandemic.
And that goes back to some of those work boundaries as well. Working from home, I found that it's almost too convenient,
right,
to not know when to quit work.
Mm-hmm.
And I really knew it was a problem one morning, at 1:30 in the morning, I was sending an email. And I had to ask myself, why am I sending this email at 1:30 in the morning?
Wasn't that to me?
Yeah,
sure
it was
that was.
to you. It was. And so I'm thinking, why am I sending this at 1:30
Right.
in the morning? It's due the next day,
Mm-hmm.
and certainly I want to get it in early, but I mean, this is a little ridiculous. So I've had to kind of tell myself, okay, work in the study during work hours and then move out of there. Don't go back in. Don't try to answer all these emails. Those
Right.
that can wait till tomorrow, let them wait till tomorrow. There's no reason to have to answer it to them.
So I've got one last question for you. So if we do have someone in our household who becomes ill and we're forced to help take care of them, what are some kind of basic things that are going to be best practice at this time when our healthcare systems are stressed and we want to remain healthy ourselves? Is there anything that we can do to facilitate the best case outcome for everyone?
Oh, absolutely. I think first and foremost, be in communication with your healthcare provider. Because you're not feeling well does not mean you immediately go in and be tested. And the reason being is that if you are ill, that also could be a way of transmitting whatever it is that you have. It still could be influenza. It still could be allergies. It could be a host of other things because all the symptoms tend to be a little familiar or similar, excuse me. So I think what's really important at this time is stay in touch with your healthcare provider and get their advisement as to what to do next. But I will tell you, in the home, when someone's not feeling well, if you have a bedroom or an area where that person can be essentially a little bit away from the rest of the family, that is really a good idea, because if they're coughing, if they're sneezing, that is not happening around the other family members. But at the same time, it's really hard to be that person who's sick and you feel afraid and you don't feel well. And what do we want when that happens? We want comfort. So it's still important to check in, and I'll let Dr. Farmer speak to that.
Well, you know, one of the concerns I have, Jessica, is when I think about that, our teammates and our neighbors who live alone.
Yes.
And making sure that they've made friends or family aware that they're not feeling well. And I think, again, through social media, we can check in on them. We can FaceTime with them, you know,
Right.
and certainly encouraging them to maintain contact with us, letting us know if they have supplies they're needing that we can drop off to them. So I think it's a time, to me, this question is probably the greatest likelihood of all that we're going to have someone in our family
Right.
that we're interacting with.
Mhm.
But to be sure that someone knows and that someone is available to help provide what care would be appropriate to provide during that period of time.
Well, you know, the CDC, and I hope everyone will go check out the CDC. It's got wonderful advice on there, but particularly around before anyone gets sick, put a plan in place.
Mhm.
So if you have somebody whose immune system is weak or there's a newborn at home, put plans in place that if this happens, this is how we're going to support each other. Then when it does happen, the panic is not there. It's more, okay, we can follow this plan. We can do this. We can get through this. And there's always somebody there to help. So to your point, Dr. Farmer, when you talk about an elderly person who lives by themselves, now would be the time to communicate with them and say, what kind of plans do you have? How can we help you out? So just being neighborly and loving and helpful, I think that's probably
Sure.
one of the best preventions that we can do, and have that plan in place.
And then allow, my wife and I had dinner with our grandchildren the other night by FaceTime.
Oh, great.
They were eating dinner and we were eating dinner.
Love it.
And we did it by FaceTime. We propped it up where we could all see each other.
Yeah.
We shared with each other what we were having for dinner. And then we just had casual conversation across dinner time.
How great.
And so I think it's continuing to maintain, even if ill, continuing to maintain that contact with others.
Yes.
And within the wonderful world we live in of social media, there are plenty of opportunities in which we can do that. So, you know, again, physical well-being, emotional and mental
Yes.
well-being,
Mhm.
you know, let's make sure that we're taking care of all of those.
So, you know, we talk about the elderly, we talk about the newborn. COVID is actually not discriminating.
Mm.
They can
Mhm.
make anybody sick.
Right.
But I want to put a plug in for our healthcare providers who are on the front lines right now. I can tell you that we have the evidence out there. We know how to take care of ourselves. But at the same time, this is a scary time for us. And so I think it's also important to reach out to your sons, your daughters, your neighbors that are healthcare providers and ask them, is there something I can do for you in the event that somebody in your family gets sick? How can I support you and help you? So this is really, I've seen some cute memes about this being a Category 5 hurricane for the healthcare industry, and it absolutely is. And so any kind of support is
Mhm.
greatly appreciated, because these are tough times. And then Dr. Farmer, do you have any final
Well,
thoughts?
give them permission, create the psychological safety that it's okay to talk about how you're feeling.
Yes.
Because often our healthcare workers are just kind of pushing that emotion to the back in order to take care of
Mhm.
everyone else and not necessarily dealing with that emotion on their own. So let it be okay for them to talk about it. If a nurse is afraid, that's okay. It can be okay for that person to be afraid about it and to talk through those fears. So I think just some permission to talk about it and to be supportive, be listening, be encouraging to them, be thankful to them for the sacrifice that often they're making to continue to be out there on the front lines working, putting themselves often in danger
Right.
in order to care for all of us.
Thank you both so much for your time today. I really appreciate it. we're hoping that this segment was useful for you all out there, and we would love to bring you more information. Please send any suggestions or comments for future topics to the email address below. And then please regularly check in with the UNT Health Science Center's COVID-19 webpage, where you'll find up-to-date information about the virus and how you can keep yourselves healthy.